Now it's time for Our World, and this week Zeynep Badawi goes to Greece, a country where cuts to the healthcare system mean some people are having to turn to charities to get their treatment.
Athens, Greece, 2013. 6 years of recession and 4 years of tough austerity measures have taken their toll on the nation's health.
I have 4 children. My husband is sick and Christo, I don't have work. I don't have possibility to pay for the doctor. It's problem.
Many thousands of people are turning to charity for vital medical treatment. The state is failing them.
We are in a crisis. We are in the beginning of a humanitarian crisis. So we are here in the same way we were in the third world because there are problems.
I've come to Greece to find out how healthcare has been affected by austerity measures that have seen income slashed, taxes increased and unemployment rocket to nearly 30%. Is there now a health crisis that is literally costing lives? Katerina and Alexandros live in the north of Athens with their 4 boys. Christos, their second child, is 7. 6 months ago, he was diagnosed with a rare illness called angioneurotic edema on the larynx, inherited from his father. This condition causes parts of the body to swell up. An attack can happen at any time and it can be life-threatening.
Γιατί αν τα ειδήματα είναι στο πρόσωπο ή στο πρόσωπο, λάριγγα και οτιδήποτε, μπορεί να μείνει χωρίς οξύγονο και είναι πάρα πολύ επίγον και επικίνδυνο αυτή η πάτηση.
Τον είχε νιώσει έτσι το Χρήστο και αφού είχε ζαλιστεί το παιδί, είχε μελανιάσει τόσο πολύ. Και τον πήραμε στα χέρια και πήγαμε στον παιδόν πέρα και είχε μείνει 2 μέρες μέσα.
Νικήσαμε τον κόβο.
Christos can suffer an attack several times a month. And when he does, he needs an injection costing €600. Money his parents simply can no longer afford. Before the recession hit, like 97% of people in Greece, this family's healthcare needs were covered by work-related insurance, which met a large portion of their health bill. So, when they hit hard times and had to close down their cafe business 2 years ago, this couple not only lost their steady income, but their health insurance too.
Τώρα πια δεν είναι, δηλαδή είμαστε οικονομικά χάλια, με δυσκολία εξασφαλίζουμε τα απαραίτητα το παιδιό μας, δηλαδή έχει αλλάξει η ζωή μας όλη, ο τρόπος της ζωής μας. Κάθε φορά αναγκάζομαι και λέω ψέμα πως είμαι ασφαλισμένη για να μπορώ να κάνω χρήση χορήγηση της ένεσης που χρειάζεται εκείνη τη στιγμή.
At their wits' end, the couple take Christos to this voluntary-run clinic in the south of Athens. They've come to see Dr. Georgos Vichas, who works at the clinic in his spare time from his regular job as a cardiologist.
Καλά είσαι? Όταν το έπαθες αυτό που σε πήγε ο μπαμπάς και η μαμά στο νοσοκομείο, τι ακριβώς αισθάνθηκες?
Ότι ήταν το μάτι μου σαν κλειστό.
Dr. Vichas will try to get a local hospital to provide Christos free of charge with the injections he so desperately needs. Christos and his family are typical of the patients who are flocking in ever-increasing numbers to see Dr. Vichas and his colleagues.
Δεν χρειάζεται να το πει κανείς, αρκεί να ρίξει μια ματιά στο κοινωνικό ιατρείο και να δει τους ανθρώπους που είναι εδώ. Η κρίση τα τελευταία 3 χρόνια στο χώρο της υγείας στην Ελλάδα έχει πάρει διαστάσεις ανθρωπιστικής κρίσης. Υπάρχουν νεκροί, υπάρχουν άνθρωποι που έχουν υποστεί μη αναστρέψιμες βλάβες στην υγεία τους.
This man could not afford his medication.
I have diabetes I come here to take my pharmacy. They give me. I can't buy a pharmacy 150 euros every month because I have the job. I have nothing.
What would have happened if Dr. Vihas had not helped you?
I am dead. So easy. I'm dead.
This couple couldn't get access to maternity care for the birth of their baby.
I had a small business venture, and unfortunately, due to the crisis, we had to close the business. And because of the fact that I'm uninsured, even the public hospitals don't give you the opportunity to give birth to your child.
Did they turn you away?
They said that I have to pay money for this.
When you said you couldn't pay, what did they say to you?
They said you have to. We cannot undertake delivery of a baby without you paying the money, the sum of money that you're supposed to pay because you're uninsured.
It's quite incredible just how many people have come to depend on this community clinic. It's only been around for 18 months, and yet now there are more than 9,000 people on the books, and that number is growing practically by the day. This single mother is the sole carer for her bedridden, disabled daughter who's just been diagnosed with cancer. With no means of paying for treatment, she's come to the clinic for help. Dr. Vihas told me he has 12 cancer patients on his clinic's books who, because of financial worries, delayed treatment and have jeopardized their own lives. Dr. Vihas's clinic is just one of around 40 community clinics that have sprung up across the country in the last 18 months. Alongside them are a growing number of clinics like this one west of Athens, run by established international charities, more used to operating in war zones and refugee camps than in European Union countries. In just one weekend, they see more than 150 children and give around 100 vaccinations.
Why an NGO, an international NGO that used for years and years to work abroad in third world, has to return in home? Because we are in a crisis. We are in the beginning of a humanitarian crisis for the poorer people. I can just tell you that the numbers of the Greek who attend our clinics, they are 5 times up the last 2 years. So we are here in the same way we were in the third world because there are problems.
So why is this basic preventative medicine being provided by a charity and not the state? The health sector in Greece has been hit by a triple whammy. The unemployed now have no health insurance and need free treatment. Greeks who previously used the private sector are now turning to the state as household incomes are squeezed. And spending cuts have drastically affected the ability of the National Health Service to deliver care. All this is the result of austerity, introduced 4 years ago as a condition of the €240 billion rescue package for Greece. The measures are deeply resented and have led to demonstrations like this across the country. 5 years ago, public spending on health was at its height at more than €16 billion. It's now been slashed by a quarter, and for hospitals that means government spending has been reduced by about 30%. Hospitals like Evangelismos General Hospital here in Athens are at the sharp end of medical care. Of course, they consume the largest portion of the health budget, but there have been reports of a shortage of supplies and staff in such hospitals, so I've come to find out more. Ilias Sioras has been a doctor here for 25 years. He's convinced that services are being affected because of the cuts.
Και σιγά σιγά μειωνόντουσαν οι παροχές μέχρι το 2008. Από το 2009 και μετά, με την κρίση, μειώθηκαν πάρα πολύ. Ο βαρύς τεχνολογικός εξοπλισμός που έχει κάνει ήδη απόσβεση είναι στον ιδιωτικό τομέα. Έχουμε μεγαλύτερη προσέλευση. Πάνω από 20.000 κενές θέσεις νοσηλευτών και πάνω από 5.000 θέσεις γιατρών.
I was invited to meet the man with overall responsibility for running Evangelismos. The chief executive here says he's managed to make all of his savings through efficiencies. Your spending was 159 million euros in 2009. The cuts have meant that it's gone right down to 103 million euros in 2012. Where did you lose that money? And have you not compromised patient care as a result, the quality?
It's not the point of quality. We are trying to get the right goods at the right price. This creates because the suppliers have reduced the prices. We are working more entrepreneurially with them. But in the past, maybe we are not analyzing what was going on.
You don't have staff shortages?
We were focusing more on the goods, on the medical goods, but we were not evaluating how much we were spending. Now we evaluate everything.
He denies the hospital has been left short of supplies. I can see syringes here.
Right. Somebody advocates that we don't have this. It has become very popular. Or gloves, we don't have something like this.
So what is your conclusion then? Do you believe that there were savings to be made simply through efficiencies?
We do. I told you that we do have everything.
But can you make the savings through
efficiency,
through efficiencies only, without compromising the service?
There's not compromise about the service, because I told you we are responsible in order to give the high medical service to the patient. No compromises about this.
I wasn't allowed to speak to patients at this hospital, so there was no way of hearing whether they thought cost savings had affected their treatment. Back at Dr. Vihas's clinic, I met Leonidas, who was recently treated in another hospital. His story suggests that hospitals are increasingly making patients foot the bill for their own treatment. 2 months ago, in severe pain, Leonidas came to Dr. Vihas for help.
Μία ζαλάδα έκανε εμετό και την άλλη μέρα αποφασίσαμε να πάει σε ένα γιατρό γιατί νόμιζε ο Λεωνίδας ότι μπορεί να έχει πάθει ένα φραγμα.
But in fact, Leonidas had an aneurysm, or ballooning of his lower aorta. Dr. Vihas concluded he needed an emergency operation. Despite working all his life, Leonidas has no health insurance because he owes money to the tax office.
Και στην εφορία δεν παίρνω ούτε σύνταξη, ούτε έχω ασφάλεια. Γι' αυτό καταλήξαμε εδώ και μεσολάβησε ο γιατρός και με βοήθησε να πάω να κάνω αυτή την εγχείρηση.
After his surgery, to recover their costs, the hospital sent Leonidas a bill for 6,000 euros. When he couldn't pay, the debt was transferred to his tax bill, which meant the authorities could take legal action against him.
Η περίπτωση του κυρίου Λεωνίδα είναι μια περίπτωση τυπική και εάν δεν υπάρξει η κατάλληλη δημοσιότητα, πάλι θα κληθούν αυτοί οι ασθενείς να πληρώσουν. Εμείς αυτό που θα κάνουμε είναι σε κάθε περίπτωση που προκύπτει να παλεύουμε, αλλά δεν είναι αυτή η λύση. Η λύση είναι η ίδια η πολιτεία να ανοίξει τις πόρτες στο δημόσιο σύστημα υγείας, κυρίως σε ασθενείς που κινδυνεύουν η ζωή τους.
The state used to treat people like Leonidas free of charge. But pressure on hospital budgets means they increasingly enforce the rules. Back at Evangelismos Hospital, I asked Dr. Sioras what he does when a patient cannot pay for treatment.
We try to help them against the law.
Have you broken the law?
Yes, many times. Every day I broke the law because I never ask insurance for any patient.
It's not just budget cuts that have put pressure on health services. The stress of unemployment and money worries also takes its toll on people's mental health. And that further increases demand on the health system. I want to get an idea of what the situation is like for people outside of the city of Athens. So I've gone along the highway and gone south of Athens to come here to Perama. Now this is an area where most people used to work in the shipbuilding industry, but now unemployment is very high here. 59-year-old Yorgos has been out of work for 4 years since he lost his job as an airline baggage handler.
Έχω πάθει 4 κεφαλικά, έχω ζάχαρο, έχω καρδιά, έχω πίεση. Δεν είχα αυτό. Εγώ είμαι 59 χρονών, μένω στην Αφιάλη.
Do you think you'll ever work again?
Όχι, δεν θα ξαναβρω δουλειά. Η κατάσταση πώς είναι τώρα αυτή τη στιγμή, όχι.
Yorgos receives no health insurance and no income. He's now completely dependent on an international charity and not just for medical treatment. Today he's come to pick up medication and a food parcel for himself and his wife.
Να κρατήσει ας πούμε 10 μέρες, μπορεί να κρατήσει και 12 μέρες, αυτά είναι. Και μετά τίποτα, nothing. Σε σημείο που είναι στο σούπερ μάρκετ, ας πούμε, και ό,τι είναι, ας πούμε, για να πάρουμε να πάμε. Δηλαδή, μπορεί να βρεις, ας πούμε, λίγο ζαμπόνο, λίγο πάριζα, λίγο το οτιδήποτε, ας πούμε. Τα οποία, ας πούμε, αυτά, λίγο και τα τρώμε.
His desperate circumstances have left Yorgos needing psychological treatment and support as well.
It's very difficult for him and his wife. Now at their home they don't have electricity.
And has this had an effect on them psychologically?
Of course, of course. They don't hope at anything.
What kind of help can you give them? I mean, do you provide some kind of psychotherapy?
We have here at Perama 5 psychologists that they see people who need psychological help.
For some, such stress can be too much to bear. I've come to see an old friend who works day and night to help those who are suffering from stress. He runs Greece's first dedicated suicide prevention helpline.
Unfortunately, we have concrete evidence that the financial crisis has caused a tremendous blow on people's mental health in the country.
Although the numbers are small, suicide figures in Greece have risen by 25%. What kind of people get in touch with you, and typically what are the problems that they talk about?
We see that we have many more suicides amongst men. And that is so because society does put pressure on men to fulfill particular traditional roles of the provider, of the protector, of the one who is able to make it. Greek society does not really forgive flaws to men, especially when they have families.
Aris, I've known you for many years. Did you ever think we'd be having this conversation?
No, Zainab. No, I would never ever think when we first met that we would be in Athens talking about Greeks killing themselves just because they cannot make ends meet anymore.
I want to know if politicians and policymakers are aware of the impact of austerity on health. Professor Lykourgos Liaropoulos sat on the committee that monitored progress of the Greek government in meeting targets set by the European Union, the European Commission and the IMF, known as the Troika. But he resigned last year.
The main failing, of the government, they didn't realize, and the Troika, that when you have a system that depends, where insurance, health insurance, access to care, depends on whether you're employed or not, and you have 30% unemployment, you're creating a huge bomb, which in fact has exploded.
Why did you resign?
Because I didn't think that the negotiation was going the way it should. I think that there was too much emphasis on meeting some targets and not too much emphasis on what would happen to the Greek people.
Armed with sufficient evidence of a health crisis, I felt it was time to take my concerns to the Ministry of Health in Athens. Is it the case that anybody in Greece who cannot afford to buy necessary drugs from the pharmacist or who needs an operation, if they cannot afford to pay, that the state will provide the adequate care?
Κύριε Μπεντάουι, στην Ελλάδα οι Έλληνες το μεγαλύτερο ποσοστό είναι ασφαλισμένοι από δημόσιο φορέα. Υπάρχουν άνθρωποι οι οποίοι δεν έχουν πληρώσει το ασφαλιστικό του σύστημα, διότι δεν είχαν τα χρήματα, διότι ήταν κάτω από δύσκολη κατάσταση οικονομική. Αυτό, με απόφαση της κυβέρνησης, δεν έχει επηρεάσει την νοσηλεία τους και τη θεραπεία τους στο Εθνικό Σύστημα Υγείας.
I've met one elderly man who needed a life-saving operation. He got it, but it cost him 6,000 euros. The hospital was pursuing him for payment, that it was causing him and his family a great deal of stress. Do you accept that that kind of case is going on and he is perhaps one of many?
Δεν υπάρχει περίπτωση τέτοια. Δεν υπάρχει κάποιος που να πάει στο Εθνικό Σύστημα Υγείας και να πληρώσει χρήματα.
The fact that there is an increasing number of community clinics from a handful last year to now nearly 40 would show that there is a greater need on the part of the people for such free voluntary services.
Θα έλεγα ότι το βλέπω διαφορετικά. Υπάρχει η προσπάθεια του κόσμου να βοηθήσει ο ένας τον άλλον. Αυτά είναι στοιχεία μιας κοινωνίας η οποία λειτουργεί κάτω από συνθήκες λιτότητας και δυσκολίας. Αυτά είναι θετικά στοιχεία ενός πολιτισμού και μιας κοινωνίας, όχι διάλυσης.
It seems to me that the government still does not sufficiently recognise the health risks being brought about by its austerity measures. Another striking example is that in the last 3 years, Médecins Sans Frontières have dealt with outbreaks of a disease eradicated 40 years ago, malaria. Spraying areas where mosquitoes are found can control the disease, but spraying has been disrupted by government spending cuts.
In 2011, we had 57 cases of malaria in the region of Laconia. Also, we had a very few cases, but they were indicative around the Attica zone, it's around Athens. And in 2012, also we had new cases in Karditsa and even up to the north.
So can you say that malaria is now endemic again in Greece?
No, malaria is not endemic yet in Greece. If this year we get more cases of locally acquired malaria in the region of Laconia, then we can talk about it.
How many more cases?
3 more cases.
So you just need 3 more locally acquired cases of malaria before Greece is once more declared as a country where malaria is endemic?
Yeah, 3 more cases of locally acquired malaria.
So while a disease like malaria raises public health concerns, it's ironic that in 2011 the Greek government underspent on its health budget. Professor Liaropoulos believes it's high time to loosen the purse strings. So your message now to the Troika is we have not only met but exceeded the cut that you demanded on the health budget.
That's everything.
Please may we have perhaps another €500 million back that we can spend on healthcare to prevent a crisis.
Yes, absolutely. And on a matter like this, I wouldn't even ask the Troika. I would simply just go ahead and do it. Because, it's important. It's important for the health of the Greek people. The Greek population is in danger right now.
I asked the health ministry official whether the Greek government is now intending to increase spending on healthcare.
Θα έλεγα είμαστε στην καμπή στην οποία πραγματικά θα υπάρξει αύξηση του εισοδήματος μέσα στα πλαίσια των δαπανών της υγείας, έτσι ώστε, κεντρικά από την κυβέρνηση, ώστε ακόμη καλύτερα να λειτουργήσει το Εθνικό Σύστημα Υγείας.
But this is little comfort for people like Katerina and her family. She needs to know that when her son Christos next has an attack of edema, he can get the medication he needs. That certainty of care is not something Greeks like little Christos can count on in the current climate. Did you imagine that you would be in this situation in Greece? Did you imagine?
No, never. I don't imagine this situation here in Greece. It's very bad now. Very bad. I am
Traumatized?
Yes.
How does that make you feel as a mother?
I don't know. I feel very, very bad for the government, for the because it don't help. I have 4 children. My husband is sick, and Christo. I don't have work. It's my heart. It's problem.
Back at the community clinic in South Athens, Dr. Vihas has good news for Leonidas and his wife.
Λοιπόν, όλα πήγαν καλά.
The hospital has finally agreed to cancel the €6,000 they were charging him for his operation, thanks to the determined campaign of Dr. Vihas and his team of volunteers.
A happy outcome, but with 1 in 4 Greeks at risk of poverty today, Dr. Vihas sees no end in sight.
Αυτό που διαπίστωσα με λύπη μου είναι ότι μετά την επιτυχία που είχαμε με τον κύριο Λεωνίδα, σε μένα προσωπικά δεν λειτουργήσε τόσο πολύ θετικά όσο θα έπρεπε και όταν το σκέφτηκα κατάλαβα γιατί. Γιατί αυτό που αντιμετωπίζουμε εδώ είναι σαν τη Λερναία Ύδρα και τον Ηρακλή. Εκεί που κόβεις ένα κεφάλι και νομίζεις ότι κάτι έχεις κάνει, ξεφυτρώνουν άλλα 4-5. Και αυτό είναι που δημιουργεί όλη τη θλίψη.